So in previously, what we are saying about the hemorrhage in the early pregnancy. Now, what we had started yesterday about the first type of abortion. We have seen hemorrhage in early pregnancy. Maximum cause is the abortion. 95% cause is the abortion. And out of there are different type of abortion. In previous lecture, we have seen about the fetal abortion. So now we are going to continue about the next type of abortion. That is, uh, so how it is inevitable. From the word vitable, that is which is able to survive. From the word you understand what is meaning of vitable, that if it comes outside of the uterus, it is able, that fetus is able to survive on its own. That is called as a vitable. And what is inevitable? When the fetus is not able to survive on its own, the word is called as inevitable abortion. So what is meaning of it? If this abortion has taken place, if this type of symptoms are there, then we are not able to give the guarantee. That is, what is the output? It is not. What is the prognosis? It is the bad prognosis. So, what is the clinical feature? How the clinically inevitable abortion is presented to you. In that, what is the patient says that? How much is the amenorrhea? It's when we are dealing with or when we are talking with hemorrhage in early pregnancy, then but obvious in this situation, whatever the amenorrhea, it is of short period. What is a short period in early? That is sometimes a patient may be having amenorrhea for 2 months or amenorrhea for 2.5 months, anything can happen. Or if there is a heavy bleeding accompanied with clots may lead to shock. How much the patient says that there is a continuous heavy, that is whatever the cloth she is wear, that is sari or anything, whatever the bed sheet, everything, it is just means it is the blood it is present or it is not a clear blood. In that there is a presence of clots and whatever the bleeding, it is so much of severe that patient may go into a hypovolemic shock. So that is the same. Then how what is the type of pain? So patient says that there is a severe liver abdominal pain. What is how can it clinically differentiate in the fetal abortion? In fetal abortion, there is not that much of bleeding or not that much of lower abdominal pain. But in case of inevitable abortion, there is severe lower abdominal pain. Then, if we do the per vaginal examination, cervical os is open. In fetal abortion, what we are saying that cervical os is not open, it is closed. See here, it is closed. While in case of inevitable, it is open. How it is typed in fetal abortion? It is mild pain. While in case of inevitable abortion, it is the very severe pain. The bleeding, it is in the spotting. While in inevitable abortion, the bleeding, it is very heavy bleeding. Just compare fetal abortion with that of inevitable abortion. Then the next one, it is the pregnancy test, but obvious it is going to be positive because it consists of HCG. What is HCG? It is human chorionic gonadotropin. From where it is released? It is released from the placenta. It is the and it leads to the positive indication. Then it also shows that ultrasonography. Ultrasonography shows the fetus, but it is non-viable fetus and the blood inside of the uterus. While in fetal abortion, we have to understand the comparative. also do the ultrasonography, that is viable intrauterine fetus. Viable intrauterine fetus. Then it is the PV, open cervical os, pregnancy test, HCG positive, and ultrasonography shows non-viable fetus and blood inside the uterus. And what is the management what we are going to do? It is the fluid management, fluids. That is the blood, it is the have to give the transfer. Blood transfusion may be required from the lethargy because it stops the bleeding and the evacuation of the uterus. That is what we have to do, medical or surgical. DNC, dilatation and curettage. That's what is advised. Then the complete abortion. From the word complete abortion, complete, that is whatever the product of conception, it is escaped out. That is called as a complete abortion. That is, it is the expulsion of all products of conception. That is cessation of bleeding and the abdominal pain. That is PV, closed cervix. Ultrasonography shows the empty uterus. Why here it is the cervix is closed? Because the content has gone outside. So it is the pervaginal os, it is the closed. While in previous the process is going on. That's why it is the cervical os, it is open. And in threatened abortion, here it is the cervical os, it is not open. So this is the how clinically we are going to differentiate between these. Then, if you see the ultrasonography, in ultrasonography, we are not seeing any fetus inside of it. So, empty uterus. And the management point of view, but obvious, if you see in this diagram, this complete. Here it is the incomplete. And if you see the complete, all this goes into the downside. Okay, this. It is empty. So this one is incomplete because this is the process is going on. That's why what we are saying, the os is open. While in that situation, in complete variety, the os is going down. Os is closed because whatever the content, it has gone down, downside. So it is the why this one, this thing what we say incomplete one. This is closed, incomplete because whatever the content, it goes downside of it from the vagina. Now, next, what we are going to see, it is about the management. It is the D gamma, anti-D gamma globulin. That's what we have to prescribe or advise. And how can it clinically differentiate between, see, this is incomplete abortion, this is complete abortion. In that, what we are saying, this is the inner layer of uterus. So it is closed, there is nothing inside of it. While that is empty uterus, because whatever the product of conception, it has gone outside. And in this situation, it is the whatever the content which is present inside of it. So missed abortion. Missed abortion features. It is the gradual disappointment, missed abortion. That is, you missed it from the word. What is the miss? That is which call. That is the call has come, but you have not received it. But it is actually call has come. So simply, it is a missed abortion. Abortion has already taken place, but you don't know that is the abortion. The patient don't know the abortion has taken place. So how the clinical is? So features wise, it is the gradual disappearance of pregnancy symptoms, signs, and the brownish vaginal discharge because it remains inside of it and becomes thick brownish color discharge. It is not a fresh blood which is present like that of any vitamin. It is the bright red blood. But in case of missed abortion, whatever the discharge, it is of brownish color, dark color. Then the milk secretion, And pregnancy test, it is negative, but it may be positive for 2 to 4 weeks after the date of the fetus. It may sometimes. And if you do the ultrasonography, that is the absent fetal heart pulsation, but obvious uh, fetus is going to be there, but it does not show the fetal heart activity. And what is the complication of it? So complication is the fetus remain inside of it. It leads to the complication, that is the infection may be there or some septic abortion may be there, and DNC. Treatment point of view, DIC, it is DIC. Then in treatment point of view, wait for 4 weeks for spontaneous expulsion and evacuate if uh, spontaneous expulsion is not possible, then you have to evacuate it. Then if it does not come out of it, as we know that anything foreign to it inside of the body, it leads to the infection. And what is the it is the DIC, then managed according to the size of the uterus. If it is the size of the uterus, it is less than 12 weeks, then you have to think about dilatation and evacuation. D and E. There are two terminologies, D and C and D and E. And if the pregnancy it is more than 12 weeks, that is more than 3 months, then what we have to think about the tri-oxytocin drips or PDs. That is what we have to follow it. And next one is that is the septic. See, from the septic, what we understand, that is something infection is there. So septic abortion. So what is it? An abortion which is complicated by infection. That is abortion is also there, and plus there is a one additional complication, that is infection. So what are the symptoms? That what we know from the pathophysiology, if any septic condition, it is going to be present with that of abdominal pain. Second, it is the fever is going to be there because infection is there. In previous one, that is in case of whether it is related with inevitable abortion, inevitable abortion or complete abortion or threatened abortion, everywhere we do not have the fever. But in septic abortion, we are having the fever. And due to the septic condition, there is a foul smelling discharge. Foul smelling discharge and signs the patient is looking sick looking, and the febrile condition or maybe jaundice may be there, or there is an tender uterus, that is the pain in the, to do the perabdominal examination, there is an pain in the abdomen, or there is a tenderness, a tender uterus, offensive vaginal discharge or bleeding because infection which is present, septic condition, it leads to the offensive vaginal discharge or bleeding, and cervix it is usually soft or and maybe dilated. So that is the scene of related with that of septic abortion. And clinical, there are gradings of it, that is the grade 1, grade 2, grade 3. How is the grading is taking place? So depending upon the infection, where the infection is present. We know that this is related with it may be uterus, or it beyond that maybe parametrium is there or peritoneum is there. So how much the pathology is able to produce, on that basis, the gradations are there. What is grade 1? The infection is localized in the uterus. So that is one, that is grade 1. Grade 2, the infection spreads beyond the uterus. If it is crossed the uterus, then it is called as a grade 2. And it crossed the uterus up to the parametric sideways structure. And when it is more than that, it can lead to the generalized peritonitis or endotoxic shock or jaundice, or sometimes there may be acute renal failure that may be the same in case of septic abortion. So what is the complication? Complication of septic abortion. It can be used to two types of complication, that is immediate complication and late complication. What are the immediate? That may be immediately there may be severe hemorrhage may be there, severe peritonitis is there. Peritonitis is inflammation of peritoneum. Then it may lead to the pelvic abscess. What is abscess? It is the collection of pus inside anywhere in the body is called as abscess. But when it is taking place, because the whatever this septic abortion that is related with the uterus, and uterus is the pelvic organ. And if abscess takes place over there, so it is called as a pelvic abscess, or there may be endometritis, that is inflammation of inner layer of endometrium. Uterus consists of three layers: inside, middle, and outside. Inside of this layer, it is called as endometritis. Inflammation of this endometrium is called as endometritis. Then there may be septicemia, or if the hemorrhage takes place too much, or if the septic condition takes place too much, it can lead to septic shock or hemorrhagic shock. And late, that is after a long time, that is it can lead to the PID. What is PID? Pelvic inflammatory disease. What is it? That is inflammation of the upper genital tract, that is inflammation of ovaries, it may be inflammation of fallopian tubes, inflammation of the endometrium. Anywhere it's inflammation, then it is called as a PID, pelvic inflammatory disease. Then pelvic adhesions that will get close to each other. Pelvic adhesions is there, or it can lead to the secondary infertility. Now, question arises, what is secondary infertility? Infertility means unable to conceive if they are having sexual intercourse for 1 year without using any contraceptive, then it is called as a not able to conceive, then it is called as infertility. Then there are means patient, the couples are staying together, they are not using any contraceptives, and the duration is 1 year, but still the couple is not able to conceive, then it is called infertility. There are two types: primary and secondary. Primary, that never ever conceive, then it is called as a primary infertility. And what is secondary infertility? That patient says that I am having patient says that I'm having one child, but we want a second child, but we are not able to conceive. Then it is called as secondary infertility. So how the clinical patient comes to you? So patient says that what happened? So patient says that you're not able to get the pregnancy, not able to get the pregnancy. So if you ask the history, okay, what is the problem? She says that I'm having one child, and the second time I'm get pregnant. Then there is an abortion where there is I'm having severe fever. Then there is lots of problem during that pregnancy that it gets aborted, septic abortion, and now again I want to conceive it, but the woman is not able to conceive. Then it is called as a secondary infertility. So from the symptoms we can understand it, that is fever is there, abortion is there, then you can think that is related with that of septic abortion, and that septic abortion leads to the complications like secondary infertility. Okay. So now what is the management? Now you know that if woman is coming with that of abortion, where there is an infection has already taken place. Now how you are going to manage it? So from the management, because hemorrhage is there, as we know that what is we have to mention ABC, that is airway, breathing, circulation. There is no problem of airway. So what is the basic thing? That is the uh, hemorrhage is there, so what you have to think about the management of the fluid levels. So because hemorrhage is there, so what is the complication? It may lead to the hemorrhagic shock. So what is our role? That we have to maintain the input and output of it. So what is the fluid level management? So what we can advise over here? The IV fluid. That is the resuscitation. So IV fluids. So what we can advise? River lactate we can advise. Nitrile not homeopathic, it is the NS that what normal saline what we are advised for it. Then the insect urethral catheter so that we can able to manage the input and the, or we can able to monitor input and output properly. Then if there is any afterwards if there is an emergency, we have to again think about the blood transfusion. And for blood transfusion, what is required? Proper blood group and cross matching is required. And for the septic condition, what we have to use the antibiotics. Preferably cephalosporins. If not available, then you can think about the ampicillin and metronidazole. That is proper. But from the homeopathic point of view, we have to think about that. Belladonna, Silesia, drugs that what we have to think about. And from the prophylactics, that is the anti-venom serum of 1,000 units and 2,000 units of anti-tetanus serum, that is modern day treatment. And definitely, we have to remove the product of conception because there is no chances of prognosis of pregnancy. So whatever the products of conception, which is remain inside, because this is a very good source of infection. So that we have to remove it. So that is what we have to do the evacuation. And whatever the hemorrhage has not that much of severe, then what we have to think about it is the hematomas that what we have to think about. Then recurrent is now next variety that is recurrent. What we have seen in the previously, let's see. There are in the types of abortion, there may be single or multiple. One second. In starting, we have seen, yes, in this yes. See just here, in types of abortion, it may be isolated, that is single. But if it is taking place repeatedly, then second variety, it is called as a recurrent variety. We have seen all this: threatened, inevitable, complete, incomplete, missed, and septic. Now we are going to see about the recurrent abortion. In all these, the females are presenting once abortion. While in recurrent abortion, sorry, there is a repeated abortion which takes place. That's what we are going to see the next. Recurrent, from the word we can understand, that is there is a frequently repeated abortion is taking place. So recurrent miscarriage or abortion. What is it? How much times? When? It is defined as 3 or more consecutive pregnancy losses. So it is not the history of abortion for once. It is the history of abortion for 3 or more than 3. But it is like that. The patient is having one pregnancy, it is a normal delivery takes place, then abortion, then again one pregnancy and the normal delivery, then abortion. It is not the same. How it is actually? One abortion, first abortion, second abortion, third abortion. That is consecutive. If it is their pregnancy losses, then we can call it as a recurrent miscarriage or recurrent abortion. What is the other synonym for it? It may be called as a habitual abortion, also called as a habitual miscarriage, also called as a recurrent abortion, also called as a recurrent miscarriage. All are nothing but the same, that is recurrent miscarriage. Then what is the etiology? Why this is happening? That is the female is getting the pregnant. There is no problem for the pregnancy, but problem related is for the continuation of pregnancy. So what is the reason for it? So in 30% of cases, what we observe that it may be some genetic factors. Sometimes it is the endocrine factors. Sometimes that is the anatomical factors. But sometimes that is the infectious causes. And next one, it is the immunological problems. So these are the out of 100 recurrent abortions, 30% we have observed this. That is genetic, endocrine, congenital anomalies, and infectious and immunological problems. So that is it. So what is congenital? Say in this. Okay, this one. These are the congenital anomalies. That is uterine divergence. Everything it is two. Two uterus, two cervix, two vagina. So uterine, that means two. So in that the fetus is not able to grow that much. So it leads to the recurrent abortion. That may be the same. This may be uterus. This is the total septum. It is complete one. And this is unicornis. Uni means only one side. And this is of too small in that the pregnancy is not able to continue for up to the 9 months, 7 days. So it can lead to the recurrent abortion. So that is the cause for recurrent abortion, one of the cause of recurrent. And there may be some other causes for the recurrent abortions, that is some infection. So which infection? That is some microorganisms can lead to the abortion. So which one is that? It may be toxoplasma, it may be rubella, it may be cytomegalovirus, it may be herpes. See, TORCH, TORCH. TO stand for toxoplasma, R stand for rubella, C stand for cytomegalovirus, and H stand for herpes simplex. So these are the microorganisms which are responsible for the development of which are responsible for the development of it. So now what we are going to see. So what we are seeing about the different causes of it. So today what we are seeing about the different types of the abortions. That is the threatened abortion. First, what we are seeing the threatened abortion. Then second one we are seeing the inevitable abortion. Third, what we have seen about the third what we have seen about the complete abortion, then what we are seeing about the septic abortion. If you do the comparison point of view. Now, first comparison, it is the per-vaginal bleeding. So, if you say in the threatened abortion, there is no per-vaginal bleeding, or if it is present, it is slight. In inevitable abortion, there is a fleshy and heavy bleeding is there. While in case of complete abortion, whatever the products are already coming to less per vaginal bleeding. While in case of septic abortion, see the per vaginal bleeding, it is offensive bleeding, and whatever the color, it is the dark color. In threatened abortion, the color it is bright red. In case of the inevitable abortion, again it is the dark red blood with flesh. Clots are there. In case of complete, the abortion has already completed, so less blood is there. And in case of septic abortion, it is the dark and dark color. Now, next point, it is the offensive point. I'm just telling you from the comparative point of view. Then from the smell point of view, in threatened abortion, there is no smell. In case of inevitable abortion, slight little bit of smell may be there, flesh is may be there. The incomplete, there is no smell, while in septic abortion, there is a offensive smell. Next, abdominal pain. In threatened abortion, slight abdominal pain. In inevitable abortion, severe abdominal pain. In case of complete abortion, no abdominal pain because the process has completed. While in septic abortion, there is a abdominal pain, and in missed abortion, there is no abdominal pain because the patient doesn't feel anything about it. While in case of per os, os per vaginal examination os. In threatened abortion, os is closed, while in inevitable abortion, os is open. In complete abortion, os is again closed, while in septic abortion, os is open, and missed abortion, os is closed. And fever point of view. If you see the fever, in threatened abortion, but obvious there is no fever. In unilateral abortion, no fever. In complete abortion, no fever. Missed abortion, no fever. Septic abortion, there is a fever. Now, from the ultrasonography. In threatened abortion, ultrasonography, what we are seeing the fetal activity are normal, means activity is taking place. In inevitable abortion, we are seeing the product of conception but no fetal activity. In complete abortion, whatever the product of conception, it is goes outside. So no empty uterus, we can say that. And in case of the septic abortion, we are seeing the parts of the fetus. While in case of missed abortion, we are seeing the parts of the fetus, but there is no cardiac activity, which is present in the fetal abortion. While in missed abortion, there is no cardiac activity. Now, from the prognosis point of view, threatened abortion, yes, good prognosis. If you are able to manage it properly, the threatened abortion can continue with that of pregnancy. Inevitable abortion, bad prognosis, no continuation of pregnancy. Complete abortion, no continuation of definitely no question of continuation of pregnancy. Septic abortion, no continuation of pregnancy. Missed abortion, no continuation of pregnancy. Now from the management point of view, in the threatened abortion, we have to give the reassurance to the patient. I'm just explaining same from the comparison. While in case of inevitable abortion, what we have to think about is we have to do the DNC, validation and evacuation. And again, this complete abortion, everything it is comes out, that is product of conception has comes out. In case of septic abortion, we have to give the antibiotics. We have to remove the part by the DNC if it is less than 12 weeks. Again, missed abortion. Again, we have to, if it is less than 12 weeks, we have to think about the DNC. And if it is more than 12 weeks, then it is the mini labor, that is going to be the oxytocin. That is depending upon the how much duration of it. So these are the common clinically variation. That is how we are going to differentiate between threatened, treated abortion, inevitable abortion, complete abortion, missed abortion, and septic abortion. While it is a recurrent, that it is the repeated abortion has taken place, so we have to do the cause investigation. That is why, because we have to rule out. Hello, we have to rule out the cause, that is the microorganisms which are responsible for this. So that is what we have seen in this. That is the toxoplasma, rubella, C for cytomegalovirus, H for herpes simplex. And clinically, which patient knows about the there is a abortion, does not know about the abortion, is the missed abortion. And there is only single one where there is a fever, that is the septic abortion. So this is the way we can understand how the abortion, that is the cause, 95% cause of hemorrhage in early pregnancy. And again, remember this, whatever this abortion cause, what we have seen it is during the early pregnancy. So all the females which we are seeing over here, which comes in the early pregnancy, that is how much, that is some females are having 2 months amenorrhea, some females are having 2.5 months amenorrhea, some females are having 3 months amenorrhea, some females are having 3.5 months amenorrhea, some females are having 4 months amenorrhea, or some females are having just some females are having 1 month amenorrhea. So depending upon the case, that is how much month of amenorrhea she is having, we have to decide the further line of treatment, whether 1 month, whether 1 month, 1.5 months amenorrhea, or whether it is the 2 months amenorrhea. Okay, so what we are seeing today, it is the hemorrhage in early pregnancy and the different causes of it. In the next lecture, we are going to see about another cause, that is the ectopic pregnancy and the hydatid pregnancy. Fine. If you have any query regarding this the topic, that is that we have finished today about the topic, that is the maximum cause, 95% cause of hemorrhage in early pregnancy, that is the abortion, we have finished it. Okay, thank you very much.
Thank you, ma'am.
Okay, if you don't understand,
Thank you, ma'am.
okay, if you don't
Thank you, ma'am.
ask it, fine. Okay, have a good day.